Hi, my name is Catherine Dornbrock. I'm a nurse practitioner in the special care clinic here at Children's Hospital, Colorado. And I am here today with some of my favorite colleagues and coworkers and friends, Barb Heff, who is a nurse in the special care clinic, and Erin Pruka, who is a nurse in our child health clinic. And we're really excited to be here today to talk to you guys about a project that's very special to us called the Adaptive Care Program that we have here at Children's Hospital. And this is a program that helps with strategies for children, specifically with developmental delays who experience anxiety in the healthcare setting. We don't have any financial disclosures to go over. And our objectives are simply to explain to you maybe why adaptive and care plan is important and the problems that it can help with, and to go over the program that we have here at Children's and how we integrated it into our primary care clinics, and maybe some strategies you could use to implement it into the setting that you work in. So why adaptive care? So my journey with adaptive care started probably around 9 years ago. I was a fairly new nurse practitioner in the special care clinic at the time. For reference, our special care clinic is a primary care clinic, so medical home designation, and we provide well care and sick care and care coordination for somewhere in the realm of 5,000 kids from our local area, as well as our greater region, our state and the states around us. We are the largest medical complexity care clinic in the country. So as you can imagine, many of our patients have very complex medical backgrounds, interact with the healthcare system on a regular basis, and most of them have had that interaction consistently since they were in the NICU or the newborn center, and have had many procedures done even at a young age. And so oftentimes these kids experience anxiety in the medical setting. So as a new nurse practitioner, I love this population, and I love seeing kids with developmental disabilities, and I appreciate that they can become very anxious at times. And so I was seeing many of these patients, and one of these patients that I saw, his name was Josh, and Josh had Down syndrome and developmental delays, and he had just moved to Colorado from out of state he had a single mom who cared for him and his sister, and was coming to special care clinic for their very first appointment to establish care in the Colorado area. So usually our first appointments are really pretty important. As you can imagine, we're trying to get their whole health history, get it well documented, get their medications set up here with local pharmacies, get all the referrals into the different specialists that they may need, and also do a good head-to-toe exam so that I can assume that role as his primary care provider. Well, unfortunately, that first visit with Josh did not go as planned. Mom took the day off work. She kept him home from school, brought him in. He looked very cute, but he was very agitated and became very escalated. And as I tried to talk to Mom, he became more upset. We brought in some toys. He started throwing the toys. He started spitting, trying to run out of the room. I have this picture of a tornado here because that's sort of what it reminded me of. It was just a whirlwind. We were doing our best to contain something that was just really out of control. I think after we took the toys away, he took off his shoes and threw a shoe at me. And so at that point, we decided, all right, we're just going to call it a day. And Mom gathered her stuff, and I sort of helped keep him safe as she gathered her things, and so she could take him home. And I think she probably left feeling really frustrated that she had, taken the day off work and brought him in, and we really got very little to nothing accomplished. I wasn't able to do an exam on Josh at all, and I left feeling really discouraged that we weren't able to give this family what they had come in for, and I wasn't able to get a good feel for how best to set Josh up for success in the healthcare setting here in Colorado. And I felt like there had to be a better way to do this because he was not my only patient that had these symptoms. Shortly after that, Barb and I went to a lunchtime educational session put on by one of our, Dr. Patel, one of our wonderful psychologists here at Children's. And she was talking about the differences that children with neurodevelopmental differences, the way that they learn, the different ways that they experience the world. And it was really eye-opening to me, and something that I don't think we get enough of, and probably in our education. And I thought it could really help with maybe the way that you care for these kids as well. And so some of the things I learned is that these kids really struggle with too much verbal communication. And I feel like that's the way sort of our go-to in medicine is we either lecture or explain, and we do a lot of verbal teaching in medicine. And so knowing that these kids, it usually either goes over their head or they get overwhelmed or they just pick out one detail and hyper focus on that. And it's really an ineffective way to teach to them. Again, they can get really focused. You can go over this big picture idea and maybe they just hear one word that seems scary to them or uncomfortable. And they get so focused on that one word or that one step of all that you said, they didn't even hear the rest of what you said. These kids really enjoy predictability and routine. So our children with autism and all of these types of diagnoses, they depend on that routine to make them feel safe and comfortable. And so for most of our kids, the morning routine looks like you get up, you have breakfast, the school bus comes, it takes you to your classroom where you get to see your friends at school and your teacher who you like. So on the days when they get up and the school bus comes and leaves without them, you know, they're already feeling stressed. They don't know what's going to happen at the doctor's office. They don't know us as well as they know their teachers. And so a lot of times they're feeling some anxiety or stress because their routine is disrupted before they even get to your office. You're kind of working that uphill battle. They're very visual in the way that they learn. And so pictures are huge, showing them what you're going to do, either by letting them, you know, showing them the equipment that you're going to use and showing them in real time or showing them pictures of the steps is really, really helpful and a simple way to communicate with them. Many of these kids need extra time to process information, so presenting it and then giving them a little bit extra time to think about it or process it prior to it happening is really, really helpful. And if you work with this population much, I'm sure that you know that a lot of these kids experience sensory sensitivities, either auditory, it can be visual or touch, but a lot of them either don't like, they get overwhelmed with too much sensory input, or some of them are sensory seekers. It can vary, but anything on that spectrum is really helpful to know about that child. They can have challenges with communication. We have a lot of kids that are not very verbal. They might be very bright, but sometimes can't communicate verbally what they want to say. So maybe they communicate with sign language or an augmentative communication device. It's important to know that because they can get really frustrated or feel very scared if they feel like you don't have a way of understanding. And they can or they may struggle to understand the rules of social interaction, like physical boundaries and how far apart they should stand from you, or things that are appropriate and things that are not appropriate. And so sometimes those things can get them present some challenges. So now I'm going to show you a video from a child's perspective of what it feels like to come into the atrium of our hospital. Now, the atrium of our hospital is a really bright, sunshiny, colorful place that I really find interesting and uplifting. But you can see from this video, because at first it will show how you would experience it if you were a typical child. And then the second part of the video is going to show how you would experience it if you had sensory sensitivities, and how different those two experiences can be even in the same place. Brighter. You're not able to filter out the background noise like the baby crying as well. You almost feel dizzy with all of the colors and height and the large expanse of the space. So hopefully in that you're able to see just the subtle differences and just how much more intrusive the little background noises that we just filter out and stop hearing after a minute can be to these kids, and can imagine how they may feel stressed again before they even make it through the front door of your clinic just because of the busy street they may have walked down or what they came through to get to the clinic environment where they're going to see you.